Welcome back to the Quantum Couch. I am your host, Dr. Ina Conboy. My today's guest is Dr. Ying Wang, with who I will be diving into a topic that's both widely discussed and often misunderstood: ADHD, also known as attention deficit and hyperactivity disorder. ADHD isn't just about being distracted or hyper. It is a neurodevelopmental condition that can affect everything from focus, memory, and time management to emotional regulation and self-esteem. It shows up differently in kids and adults, and often gets missed, especially in women and girls. Traditionally, ADHD is treated with medication management, most commonly stimulants like methylphenidate or amphetamine-based medications, which can be life-changing for many. But that's just one piece of the puzzle. Psychotherapy, particularly cognitive behavioral therapy and executive functioning coaching, can help individuals build practical tools, restructure thought patterns, and strengthen self-awareness and self-compassion. And then there's the often overlooked realm of nutrition and supplementation. Emerging research points to the role of things like omega-3 fatty acids, zinc, magnesium, iron, and even gut health in supporting attention and mood regulation. Some integrative practitioners also explore elimination diets or blood sugar stabilization to reduce symptoms. So, in today's episode, we'll explore the full spectrum of ADHD treatment, from evidence-based medications and psychotherapy to the growing world of holistic and nutritional approaches. To help us navigate today's journey, I am thrilled to have Dr. Ying Wang as my guest. Dr. Ying Wang is a psychiatrist, psychotherapist, and the founder of Buck Psychiatry PLLC, an innovative private practice offering integrative mental health care for high-functioning, overwhelmed individuals. She is licensed in New Jersey and Pennsylvania, where she lives with her husband, two spirited sons, and one equally opinionated bunny. Dr. Wang received her medical degree from Yale University and completed her residency in adult psychiatry at Harvard Medical School, where she served as a chief resident. She previously practiced at Harvard Vanguard Medical Associates and taught Harvard medical students as a clinical instructor. Dr. Wang is also a published author and speaker. She has written a children's book series on emotional wellness and contributes essays on mental health and parenting to Psychology Today and other platforms. I've read some of her articles and they're really, really good. Highly recommend. Dr. Wang, welcome.
Thank you so much, Dr. Conboy. It is truly a pleasure and an honor to be here. As you know, I'm a big fan of yours and just so impressed and, so proud of what you're doing beyond work. I mean, I think very highly of you as a clinician and as a friend, but what you're doing with the podcast is just truly impressive. You ask such good questions and they tickle my mind in the right way. So thank you for doing this and thank you for having me on the show. And thank you for that lovely introduction.
You're so kind, Dr. Wang. Many of you don't know, but Dr. Wang and I are actually also peer supervisors and very good friends. And so it means a lot coming from you that you like my podcast and you're supporting me. Thank you. Thank you very much. And I've been really looking forward to having you on here for a while now. Last time we were supposed to record, a lot of people in your family got sick, so it couldn't happen. So finally that we're able to make this happen.
Everybody's alive, everybody's healthy, and I'm here.
Knock on wood.
Knock
Yes.
on wood, that's right.
Well, so you're obviously a very well trained and accomplished psychiatrist. You have a lot of experience, compassion, and a continuous thirst for knowledge. Could we begin by exploring what set you, an already successful psychiatrist, on the journey toward integrative ADHD treatment? Why add anything to the already existing psychotherapy and medication management combo?
Good question. I'm afraid I don't have a straightforward answer to that, and it really was a process. And to be honest, when I started, ADHD wasn't a condition I loved treating. For better or worse, I felt frustrated because there are medications, they're powerful medications, but beyond medications and cognitive behavioral therapy and some skills coaching, I felt like I didn't have many other tools. And there is this stigma that medications come with side effects and the medications are abusable. And we know that people that use stimulants appropriately under medical guidance are less likely to abuse them. But when I was starting out, the stigma was still unfortunately profound. And there was a part of me that was afraid to kind of delve too deeply into this area. But then as time went on, I started having a lot of patients on my panel who are highly successful, neurodivergent, and a lot of them actually have ADHD that were never diagnosed or were diagnosed but never properly treated. And I was kind of forced to learn about ADHD in more depth, understand, the various treatments and limitations of the tools that we currently have. A lot of them came already with their own strategies on different supplements that, I frankly learned from a lot of my patients. So I really, dug deep and educated myself because my patients were bringing these tools and strategies to me that I, was not well informed in.
Sorry, just kind of rewinding a little bit.
Sure.
You've mentioned that you had a lot of patients who came into your practice who were not really like diagnosed with ADHD, who were neurodivergent. How is it that so many people have been maybe underdiagnosed or not diagnosed? In this society, in this day and age, a lot of doctors like, oh, everybody gets diagnosed with ADHD. But yet, you and I think we've had this talk even outside of this, are seeing incredibly successful people, brilliant, very smart, and yet not diagnosed with ADHD, even though they have the resources to. What is your understanding of what's happening here?
Yeah, good question. I think part of it has to do with age. Some of my older patients grew up in a time when there just was not as much awareness of ADHD. So part of it is that. Part of it is that ADHD symptoms overlap with a lot of what I call human condition, the human condition, distractibility, sometimes emotional dysregulation, and we all experience some of these symptoms some of the times. And so when you have somebody who is very intelligent and very high functioning, you can those symptoms can be dismissed as they're just having a bad day or they're just stressed out. And they may have found coping strategies themselves. There's this belief that, for somebody to truly have ADHD, they need to look really impaired. There needs to be a lot of hyperactivity. And we now know that that's not true, So a lot of these people maybe did not exhibit what we stereotypically kind of associate with what ADHD looked like, a very hyperactive boy. And so they were missed. They themselves may have internalized this narrative of, I am disorganized and just a mess because there's something wrong with me, as opposed to thinking of this as a pattern of, dysfunction that arises from a medical condition. I think it's really a combination of factors. I recall, earlier in my training, a well-respected mentor who was like, if you see someone who graduated college and has solid grades and they come to you saying they have ADHD, that's not ADHD.
Really?
Yeah, yeah. It I was taken aback, but at that time, part of me internalized that, okay, if somebody truly had ADHD, then they couldn't be this high functioning. They couldn't have graduated with straight A's, and, there's some ulterior motive from them to come and ask for a diagnosis and maybe accommodations and medications. I'm not proud of this perspective, but, when I was going through training, and even to this day, I think some mental health professionals may still hold on to that belief, very unfairly so. Um,
So, are you saying that you actually get to see a lot of very successful people who have graduated college with all
yes,
straight A's who still have ADHD?
absolutely, absolutely. A lot of very high functioning individuals. And I think ADHD also varies in level of severity, like a lot of illnesses, right? So some people can be quite impaired. In fact, impairment is one of those diagnostic criteria. But we also want to think about impairment doesn't look the same way across the entire population, right? So for high people of high intelligence, their impairment may not be perceptible to us, but they know it. And I frequently hear this narrative of, I know I'm capable of much more. People tell me I should be happy with what I've accomplished. I look successful on the outside, but I know that it's a perpetual struggle. I feel like I'm a step away from disaster, or I know if I could just get my stuff together, I could be so much better. That narrative runs steep in these highly successful, high achieving individuals who have struggled with ADHD.
So how do they end up coming to you? If they are like very successful and if they are functioning incredibly well with all straight A's, graduated college, probably graduated grad school, medical school, law school, and then they end up being probably in very high positions of maybe even power or like very successful in their careers, what ends up happening that they come to you?
A lot of times they come initially because of anxiety,
Mm.
because of overwhelm. And again, this narrative of I look like I'm doing well on the outside, but internally I know I'm a mess and I'm ashamed. I feel like an imposter. Something's not right and I need to figure out what it is. And these days, with availability of information, people are doing their own research. They are kind of connecting the dots themselves and wanting to understand, I felt something's wrong my whole life. Just what is this something wrong? So, they've always had a suspicion, and now, they have availability of information that they can, finally do something about it.
So if someone comes to, for example, I'll just come up with a story, a scenario, a high functioning executive. She is incredibly bright, was on top of her class in college and in grad school, maybe has some issues with romantic relationships, but overall is very high level executive.
Hmm.
And she comes to you and says, my life is kind of not the greatest. I'm doing great at work. I can't really keep my romantic relationships straight, or we argue a lot. Like, what would you do to evaluate this patient? And let's say she does have this underlying ADHD. What do you do about it?
Yeah, so I mean, I don't start by doing an ADHD assessment. I start by doing a thorough, comprehensive initial diagnostic evaluation. So, understanding this person as a whole, understanding what their main struggles are, looking at their developmental history, looking at their overall level of functionality, understanding, the biological pieces and genetic pieces and all of that together. So, first, I'm not just going to jump in and say, like, let's see if there's ADHD. That's going to be on the back of my mind. But first, I want to understand what's really going on in this person's life and what are the main struggles. And then we try to tease that apart. A lot of times, as I said, they come in, maybe relationship struggle, maybe anxiety. And then we dig deeper. We try to understand how did these symptoms evolve over time? When did they start? And over, gradually you can kind of put this together. If it's a picture of ADHD, a lot of times ADHD is comorbid with anxiety, with depression, with a lot of other symptoms. So it's like you're a detective. You're trying to, make sense of this whole picture. And if ADHD is a big part of it, then it's something that would have existed in their childhood. There would have been signs. So we do developmental history, understand what they were like as a student, understand what their relationship patterns were like, ask questions about distractibility, about time blindness, about any tendency to hyperfocus, about their sleep patterns. So kind of putting together this whole picture. And part of that is also doing medical workups, ruling out common medical conditions that can present as ADHD, that can present as anxiety.
And what would they be common medical conditions?
Yeah, so looking at thyroid levels to make sure that there's no thyroid disruption. We commonly will look at things like vitamin D levels. Vitamin D is not just good for strong bones, it acts like a hormone. It can actually turn on and off gene expression. And so deficiency in vitamin D can directly affect synthesis of dopamine and other neurotransmitters. So frequently we want to look at vitamin D. I often look at vitamin B12. We know that deficiency in B12 is quite common it's common across the board, but in ADHD, it can mimic but also worsen symptoms of brain fog, distractibility, low mood, low motivation, um, and the full spectrum. But these are the big ones.
Interesting. And I'm guessing also you're looking for anemia just in case,
Absolutely.
and
Thank you.
kidney function and liver function,
Yeah.
which probably like you're always in the back of your mind, which is I
Yes.
think for all of
So
us
we
physicians.
would do, thorough like CBC, complete blood count to rule out anemia. I typically also do ferritin and an iron panel because, commonly we look for anemia by looking at hemoglobin levels, but the body prioritizes the amount of iron that's in red blood cells. So that may look normal when your overall iron storage is actually low. So what's available is actually low, even though hemoglobin level is normal. So we would look at ferritin, which is intracellular storage of iron. And, if that is low, then your brain is not getting optimal amount of iron. And iron is actually we can geek out a little bit. Iron is a cofactor for the rate limiting enzyme in the production of dopamine. And so,
Really?
when
I
we,
totally forgot.
yeah, yeah. I don't know if I ever learned that, to be completely honest, maybe at some point. But iron deficiency can do a number of things, can definitely worsen symptoms of ADHD or mimic ADHD itself.
It's fascinating. Did not know that.
Yeah.
Okay. So you do all of this blood work and then what?
I do all this blood work. And so if there's anything that is abnormal, we address that. And, there's a little bit of difference in how I approach what's normal and abnormal compared to, I think, primary care doctors. And sometimes this involves conversations and back and forth. So, when you get back a lab result, the standard levels are set for pathologies. So, vitamin D level of like in the 20s or high 20s, mid 20s wouldn't necessarily be considered terribly low, and it may be considered okay. But when we're dealing with people that already struggle with brain fog and inattention, we don't want to just prevent pathology. We want to optimize. So often we're pushing that level up. We're pushing beyond what's considered pathology. That's true for vitamin D. That's true for iron, for ferritin as well, for vitamin B12. So, if there are pathologies, we fix them. I may have to send them out to specialists. But, if they're not in optimal range, we would want to replete those levels to support optimal functioning of their brain. And the other part that we didn't talk about that comes up very commonly in medical evaluation is, sleep apnea or other types of
Hmm. Good
disordered
point.
sleep.
Yeah.
Yeah. Oftentimes, sleep apnea can worsen symptoms of a number of psychiatric conditions, including ADHD. When you're not getting enough oxygen, when you're not getting high quality sleep, the prefrontal cortex really suffers. And the prefrontal cortex is like the CEO of the brain, the part that does all that executive function that, isn't working so well in ADHD. And so when the sleep piece isn't adequate, then the prefrontal cortex is not going to be as effective. And that can manifest, as symptoms that are very much like ADHD. And if there was ADHD in the first place, they would get much worse. So I've sent a lot of my patients to get sleep evaluations. And not infrequently, we find that there is some element of sleep apnea. So, sometimes when that's treated, the attentional issues go away. Other times they get better. They may not completely go away, but they get better.
Interesting. And
Mm.
so if someone does have low vitamin D or vitamin B12, do you just tell them to go to the pharmacy and pick up whatever B or D they can, or do you prescribe? How do you deal with this?
Well, so this is a little bit of a nuanced issue. So these are not prescription medications. For the most part, they are safe to get, from a well-established pharmacy. But we do know that quality matters, and because they're not regulated by the FDA, consistency, even how much you're really getting in one pill, in one capsule, may vary depending on who's producing it. So I do recommend that that people look for pharmacies that are known for third-party testing or pharmaceutical grade, supplements. But if, cost sometimes can be a limiting factor. So going to well-known pharmacies like CVS, like Rite Aid, even Costco, those are fairly reliable as well. One exception I would say is when it comes to omega-3s, because mercury contamination is a potential concern there, and low quality fish oil can be oxidized easily, and that wouldn't be good. So for that one, I typically do recommend Nordic Natural, which is a brand that has, to my knowledge, very high quality and consistency.
Is it true, Dr. Wong, that some formulations of vitamins are more bioavailable than others? Like vitamin D, like for example, needs to be like in the vitamin D like 3 type formulation as opposed to another type.
Right. So you just mentioned vitamin D3 that is more bioavailable. I think for 12, there's also, the methylated form that is
Mm-hmm.
more bioavailable. For the most part, I think even if you don't get the bioavailable kind because of cost issues, your body can still do the conversion, but
Hmm.
your ability to do the conversion may vary. Individuals that have a particular type of genetic polymorphism may have trouble converting folate from the type that we get in food into the active type of folate. And so for those individuals, it's very important actually that you supplement with the more bioavailable form of folate. For other people, it's less of an issue.
Interesting. Okay. So you're getting all kinds of workup on this patient. You got sleep apnea possibly, or like test, or at least ask questions about it. You did the blood work. Then what?
At this point, then we start, the process of what I call a life audit. And a life audit basically is my opportunity to really like zoom in and understand what this person's day to day look like and where their struggles are. So I ask questions about, what's your daily routine? How much sleep do you get? What kind of food do you eat? Do you work out? Are you outside? Are you sitting in front of a computer all day? How much sleep, I already mentioned how much sleep do you get? But when all these pieces are together, patient and I will together figure out if there are patterns that may be working for and against them. And so, not infrequently, I have people actually track, what happens when you eat at a certain time versus a different time? What happens when you exercise in the morning versus in the afternoon? And, then we can kind of piece together how can we tweak things to optimize the way your body functions and leverage your most kind of cognitive alert time to do the most high impact work. So, this is history taking, but also a little bit of a life audit to help the individual identify for themselves where there may be areas, for targeted improvement.
So what typically then happens in this process? Like say you identified the areas of improvement, um, and you have decided through your research and asking lots and lots of questions that this very successful person does have ADHD.
Mhm.
Then what?
Okay. So one, it's we identify areas where we can make improvements. So the patient and I, it's not a unilateral decision. If I tell the patient, you need to exercise at this particular time, may not work. It has to fit within their biorhythm. Has to be something that they can implement. So together we come up with a strategy to kind of devise a routine that leverages their most kind of productive, most cognitive alert time to do the most difficult and high impact work. So we kind of design their schedule together. We also work on optimizing their nutrition. So part of that life audit is figuring out, are you taking in the right kind of nutrients? Because, we talk about dopamine and ADHD, right? Dopamine is a neurotransmitter that's really important for executive function, for attention motivation, but dopamine doesn't come out of thin air. You have to synthesize dopamine from the right building blocks, from the right amino acids, and then you need to have the right cofactors that help the whole synthesis process. And so, it's important to look at, are you getting these important nutrients in your diet? And again, this goes back to, supplementing when necessary, but also eating nutritious foods that will provide the right building blocks. We look at the amount of sugar that they take in. Brain runs on glucose, but while fluctuations in blood sugar can cause you to have, that crash afterwards. And so we work hard to stabilize blood sugar. So that may mean tweaking what they eat and kind of substituting, their chocolate chip cookie for maybe chocolate covered almonds or, something else, small tweaks that are acceptable to the patient, but may make a difference in the long term. So we tweak their diet. We look at their sleep hygiene. Again, sleep is so foundational to brain health. So we try to problem solve and figure out how they can obtain optimal sleep, when they should go to sleep, if there's anything that they can do prior to going to sleep to help them settle into a relaxed state. We talk about how they set up their environment, because you want your environment to work for you, not against you. So how much clutter is there? Are you set up, is your workspace set up in a way that you can easily access what you need so that you don't go chasing for it and then getting distracted along the way? Do you have people that can support you in your environment that you can turn to so that when you're feeling emotionally dysregulated, there's a safe place for you to go and process those emotions?
Mhm. So you are obviously discussing different aspects of one's life. I mean, you're basically incorporating every aspect of the person's life, their nutrition, their lifestyle, um, and you're also a physician who is prescribing medications if needed and also doing psychotherapy. Is that correct?
Absolutely. Yes.
So how do you incorporate those pieces in?
Yeah. So you know, I'm not against medications. I prescribe stimulants quite a bit. They're, as you were saying, they are potentially life changing, very effective. And so there may be a medication piece. If somebody wants to be on a stimulant, if they, one, if there's a need for stimulants, and two, if they're able to tolerate, because not everybody can tolerate stimulants. We talk about the pros and cons of being on a stimulant medication. I educate them on different classes. So there's stimulants and non-stimulants. And within the stimulant class, we have, the two kind of categories, methylphenidate and the mixed amphetamine salts. So we work together to pick something that, suits that person's particular situation. And that becomes part of the work that we do. I prescribe it and then we tweak the dosages to find the lowest effective dose. We check in on side effects. I educate them on what potentially to, keep an eye out for when it comes to these medications. You also alluded to the therapy piece, which is also a really important part of the treatment. So I think if I could take a step back, there's the medication piece, there's the kind of coaching piece, which, is kind of folded into life audit, tweaking things, teaching skills. And then there's a psychotherapy piece. Um, what I recognize in a lot of my ADHD patients is that the sense of guilt and shame can run very deep. And there often is this inner narrative of being defective, not being enough. And oftentimes that negative inner dialogue um, is what gets in the way of task completion, as opposed to lack of skills. It's that what's wrong with me? Everybody can do this, but I can't do the timesheets. I can do the much more complicated pieces, but when it comes to keeping time, I can't do it. Or why is it that, I can be a successful professor, but I can't sit down and read this text for more than 30 minutes at a time when other people can do it for hours and hours. And so there often is this narrative of something is deeply wrong, I'm defective. And when the brain quickly go to that space, it's very difficult for the prefrontal cortex to do what it needs to do to continue to be functional. And so, a big part of this therapy is kind of understanding that narrative, um, and trying to reframe that. And part of understanding that narrative is the psychoeducation piece of, understanding that ADHD brains are wired differently. And this is where, again, I get to geek out and talk to people about different neurotransmitters, brain networks, default mode network. And a lot of people, they light up when they hear about these functional, these differences, these wiring differences, because then they can kind of, say, oh, that's why this is happening. It's not because I'm just defective. It's not because I'm just lazy. So that actually, the psychoeducation piece is a big part of the therapy piece as well. Oftentimes, I do use cognitive behavioral therapy to identify these thought distortions. A very common thought distortion is just, I am a failure. I am defective. I can't do this, therefore I can't do life. And so turning that around, reframing that, and finding a way to, instead of saying, this is what's wrong with me, say, this is how I'm wired, and this is how I can work more effectively given my unique wiring. Sometimes we have to dig deeper into their childhood. Actually, often we have to dig deeper into their childhood, the dialogue that they may have had with their, parents, with their adults. A lot of times they internalize that blame and that shame from, the adults around them. There's been a lot of blame, a lot of shame around kids that can't sit still, around kids who seem to be willfully disobedient, when again it's a wiring issue. And that kind of narrative can be very damaging and can last into adulthood, into their entire lives, and become part of their own narrative. And so part of the work is then kind of going back into these earlier stages and helping them kind of step away from this internalized narrative that's not healthy for them, and kind of creating their own scripts.
Mhm. Yeah, this is profound. So, if the medication piece is working very well and psychotherapy is working very well, then why even go into lifestyle changes or nutrition or supplementation? What led you to this world if you had
Well,
these other tools?
because meds only work when you take them. It's like having glasses. You're nearsighted, right? We're getting personal here. I love your glasses, by the way.
Thank you.
But if you take them off, they don't work anymore. It's not, they don't fundamentally strengthen your eyes and improve your eyesight, right? So, sorry, not to get personal here, but it's the same thing with medications, especially with the stimulants. They're profound, they're helpful. By all means, take the medications. But if we only focus on the medication piece, we're missing a big part of the picture. So what we try to do when we zoom out and build skills, and do the coaching and do the supplement, is trying to build resilience and trying to strengthen the brain, so that even the meds may become more effective. They can be more helpful. They can, the efficacy can last longer when your brain is in a better state. And somebody said, pills don't teach skills, which is very true. Pills can help you learn skills. If you're taking, a stimulant that works for you, it can help you learn the skills that you need to learn in a classroom. But they don't teach you those skills that can be transformational. Skills like, how do I regulate my emotions when I feel like I'm about to tantrum? How do I break a large, complicated task into small, doable pieces so I don't feel overwhelmed, so I don't go into this anxious, avoiding mode? These skills are, ultimately what gives you that strong foundation, whether or not, you're taking a medication. They work for people with ADHD and people without ADHD. So quite frankly, I think, for anyone that wants to succeed or kind of move to the next level, these skills can be really, really helpful. The supplement piece, so again, going back to, we're looking at the biology. The stimulants, what they do is they increase the amount of dopamine in the synapses, the dopamine and norepinephrine. Um, but that's also just one piece of the picture, right? Like again, dopamine has to be synthesized. So these supplements provide the kind of condition for there to be robust dopamine signaling, for there to be good, robust synthesis of dopamine, um, by providing the right amino acids, by providing the appropriate cofactors that are needed to build dopamine, so that you're not just relying on the medication to increase the release or keep the dopamine in the synapses for a longer period of time while you're taking the medications.
Hmm. So then what kind of supplementations do you usually use? Like you mentioned omega-3, you mentioned B12, you mentioned vitamin D. Can you kind of explain like the supplements in your toolbox and what does each of them do?
Yeah, sure, sure. So I don't do a boatload of supplements. I'm not one of those that just throws everything. So there's
You're not
some,
a functional medicine doctor?
I am learning more about functional medicine, and there's a lot of very interesting things, and there's an overlap there.
For sure.
So the supplements that I tend to recommend for people with ADHD include magnesium. Magnesium is, in my mind, it's VIP. It's a cofactor in, I think, like some over 300 reactions that take place inside of our cell, one of which is the synthesis of ATP. Again, we'll geek out a little bit here, but ATP is the energy currency of our cells. And guess which cells are really energy hungry? Your neurons. Your neurons are the most metabolically active cells. And so if your ATP synthesis is not robust, is impaired, then your brain is going to suffer. And we do know that people with ADHD are more likely to be deficient in magnesium. So magnesium can be quite helpful. Magnesium is also important in other ways. It supports GABA function. So GABA is the inhibitory neurotransmitter, and it shifts us from sympathetic fight and flight to the parasympathetic, kind of rest and digest and relax. And so magnesium can have a nice calming, relaxing effect as well. And so, for people with ADHD, oftentimes they may have a hard time winding down at night. They may feel too wound up and restless. So having a little bit with the right kind of magnesium, the right amount of magnesium at night can also be very helpful with anxiety and with sleep. So that is a common one that I do recommend, and it's generally well tolerated. But magnesium oxide can cause diarrhea. Back in medical school days, we learned Mg is must go. You want to be careful unless you're constipated and you could benefit from that. But otherwise, I would pick something like magnesium glycinate, which is much gentler on the stomach, much better absorbed, and quite helpful for anxiety and restlessness. So that is a common one that I do recommend. We talked about vitamin D. So, vitamin D acts like a hormone, helps to turn on those genes that can help you synthesize dopamine and other neurotransmitters.
But you also only use it if you need to, right? Because vitamin D, as
Right,
far as I remember, is one of those vitamins that actually gets stored in your fat tissue and you
right.
can actually have too much of it. So you only should take it if you need it,
Right.
correct?
Yes, absolutely. So I always check vitamin D. I've not seen a case of vitamin D toxicity because most of us in this part of the world tend to be vitamin D deficient because we're not outdoors enough. We don't get enough sun. And so by and large, when I test people for vitamin D, unless they're already on a supplement, they tend to run low. So it's very common that I would put people on vitamin D. But you're right. This is one of those that you don't want to go into, you don't want to have an excess of it because it can become toxic. But I think it's quite hard to get toxic at the levels that we would typically supplement at. Um, do we talk about zinc? Zinc is a mineral. Yeah, so this is another one that sometimes I supplement. So zinc is pretty interesting. It binds to dopamine transporters, so it regulates the rate at which dopamine is cleared from the synapses. So when it binds dopamine transporters, it makes it less like efficient at clearing out the dopamine because these transporters they suck up the dopamine in the synapses and bring them back into the neurons. And so when zinc binds to those transporters, they're less, I guess, efficient at doing that. So there's more dopamine available to signal in the synapses. So when there's a deficiency in zinc, you can also run into, kind of overzealous clearance of dopamine and not enough dopamine left in the synapses. So zinc is something that also is frequently deficient in the ADHD population. Vegetarians are more likely to be zinc deficient as well. You can get zinc from both animal sources and plant sources, but the animal sources are also more bioavailable. So if somebody is a vegetarian and especially if they tell me that they have a meat or they have had meat aversion, they're whether or not they're vegetarians, but there's like a real distaste for the smell or taste of meat. That may be a sign that there may be some zinc deficiency. And I don't quite remember the science of this, but it does seem that people who are zinc deficient may have a harder time tolerating meats. And people who struggle with acne, really bad acne, because zinc is also help with wound healing and has anti-inflammatory effects. So if somebody who has ADHD comes in, tells me that they really don't eat meat, that they hate meat, and they struggle with acne, then I'd be curious about their zinc level, and I would want to check it and potentially supplement if necessary. Um, And zinc and copper have like a seesaw effect. They are competitive for absorption in the GI tract. So if somebody has a zinc deficiency, their copper level may be a little bit too high, and that has its own problems as well. So that gets a bit more complicated. But yeah, so zinc is something that tends to be deficient and is important in dopamine function. So magnesium, zinc, we talked about omega-3. So the two types of omega-3s that we want to focus on for cognition and for mood include EPA and DHA. DHA is actually an important structural lipid in the neuronal membrane, so the skin of the neurons. And for signals to be transmitted across different neurons smoothly, and for those receptors to work properly and transporters to work properly, you want to have healthy skin. You want to have healthy neuronal membranes. And so, having good amount of DHA is important. EPA has very good anti-inflammatory properties. And we do know that neuroinflammation is associated with cognitive issues, with brain fog. So those are very important. And our brains are 60% fat, by weight. So having healthy amounts of healthy fats is very important. So that's the omega-3s. We
What about
have,
saffron? I've heard recently that
yeah,
saffron somehow impacting ADHD. Have you heard about this?
I have heard of that. I haven't looked closely into the science of it. I'd be curious to read more about it. Saffron is also very expensive. Um,
Is it?
it's quite expensive. So I have heard of saffron being quite helpful with attention and focus, but exactly how it does that and what kind of studies have been done around it, I don't know enough details about.
Speaking of studies, have there been studies done about the other supplements that we have talked about?
The other supplements, which ones are
Like
you?
omega-3s and vitamin
Oh
D
yeah,
and zinc and copper and what are we missing here? Any one of those, like has there
There
been
have been tons of studies looking at these, but I think that these studies don't definitively say, deficiency in this causes ADHD or that supplementing with these will alleviate symptoms of ADHD. The results are mixed. But this is where I I struggle a little bit with evidence-based medicine and how we kind of obtain evidence. So for one thing, when we supplement with these vitamins and minerals, it's not like we just supplement with one thing. It's one of the many tools that we use. So if you just study one thing by itself and say this does not improve ADHD, it doesn't mean that this is not effective because we're not using these things in isolation, right? But there have been a lot of studies looking at these various supplements and how they potentially can improve cognition and improve attention span. Um, Going back to like evidence-based medicine, there's this common critique that giving vitamins and supplements, are not evidence-based, or that we'll talk about cognitive training maybe later, but these other strategies are not evidence-based. And you and I have talked about this. I believe that, evidence-based medicine is really the foundation, has to be built on evidence. But the way that we do scientific studies is about looking for averages, what helps someone on average, right? And we're not treating the average person, we're treating an individual. And so, in these large randomized controlled trials, one, we're isolating to one variable, which that's not how we treat ADHD. And two, we're looking across, this population. So that may wash out individual differences. And so again, I think evidence-based medicine should be the foundation of what we do, but it shouldn't limit interventions that, in your experience, one, they're not harmful. If something is harmful, I definitely would not go there. And two, if you know in your clinical experience that these things can be helpful, but there is not yet evidence to support it, I think this is where the art of medicine comes in. This is where dialogue comes in with the patient. Um, yeah, yeah. And
What was
and
the quote that you gave me at some point down the line that someone famous told you? I don't remember anymore who it
we
was
have
or what the
given a
quote was.
couple different quotes. There is one that says, I think absence of evidence is not evidence of absence, right? So
That. Yes,
that is
that's the one.
maybe we haven't found we haven't found the evidence yet. Doesn't mean that the evidence says that this doesn't work. And then the other one we just talked about today was something said by Carl Jung, and I'll probably be misquoting, but he said, science is concerned with averages, not with the individual in front of you. So, what it gains in validity, it loses in individuality. Something along those lines.
Yeah.
Yeah.
Yeah,
And I
absolutely.
I used to be one of those people that said, I'm not going to recommend vitamins because they're not evidence-based. And now I've really kind of moved beyond that. And, I do, in my clinical experience, I see people functioning much better when their ferritin is repleted, even if they don't have overt anemia. I see people doing much better when their vitamin D level is boosted up, over 500 and not just sitting at the low 300s or, upper 200s. I see clear evidence of that. People tell me they feel better. And so I'm all about, these interventions, these low hanging fruits that can make a difference,
So
even if
if
they're
you
not
were
part of the standard treatment.
so if you were that psychiatrist,
Mhm.
Harvard trained,
Doctor that told me that if somebody graduated with straight A's, they couldn't have the ADHD. I love my training. It was wonderful training, but certainly I feel like I was not well prepared at that point to have a real solid understanding of ADHD and its treatment.
so how did you even arrive to vitamins? Like what made you kind of say like I'm gonna look into this?
Yeah. So a lot of patients came to me already having been on them. And so they asked me. And my initial reaction was, well, that's not the gold standard. That's not part of our
It's so
development.
unscientific of you,
Yeah, right. But
patient.
then I was like, I have to listen to my patients. I need to, one, I also need to look into the science, the biology of it. So that's where I was excited to read about how these trace minerals are cofactors in these reactions. And, like we all admit that dopamine is important, norepinephrine is important, but where do they come from? How are they made? And, that's where understanding the biology of it, I feel like that we that's actually important. It's important to recognize that there may be a very valid rule for these vitamins and minerals. The other part of this is a little bit of self-revelation. Like I discovered that ADHD runs deep in my own family, and so when it becomes personal, you do all the research you can, you find out everything you can about it, and so that was an extra motivator for me to look into various treatment modalities for ADHD.
Speaking of very highly successful people in ADHD, do you see a correlation between giftedness and neurodivergence like ADHD and or autism?
Yeah, yeah. Interesting question you ask. And I could ask you that question because we see similar patient populations.
Very.
Yeah, but I do see, not that everyone who's, ADHD is gifted, but I do, in my population, I do see a lot of gifted individuals who are neurodivergent, including ADHD and being on the spectrum. The wiring of ADHD, and I think this field is still evolving, is such that the brain can also be quite powerful. ADHD brain can also be quite powerful. That kind of ability to, hyper focus on things that really like ignite them and make them interested can result in hyper productivity and creativity and out of box thinking. And even a little bit of that impulsivity may, help certain individuals take on risks that a person who's more neurotypical may think about it, but maybe not go that extra step, may not go outside of that box and push themselves in that direction. And so I do think that there are ways in which different wirings, whether it's ADHD or something else, can confer unique strengths and advantages that is not available to the neurotypical brain.
Hmm. Interesting. Yeah, maybe this would be an entirely different episode that we can do on neurodiversity to begin with, because I
Mhm.
think that you and I do see a lot of very neurodiverse people by nature of just the patients that we see. But I have also noticed that there is a very high correlation between giftedness and perhaps other neurodiverse conditions, and whether it be OCD or ADHD or on the spectrum. And I don't really know if I have yet met a person who is gifted, that does not have some
Uh,
neurospice to them.
yeah. Yeah, I feel the same. Yeah.
It's interesting. And this is the part that we don't learn at all in medical school. And I feel I didn't even learn any of this in my residency program.
In here.
There was nothing about really neurodivergence. Like autism was Rain Man, and ADHD, what is that? That's probably someone who's malingering for
Med
some.
thinking. Yeah.
Yeah, exactly. So there was like really no education on this. So this is something I really had to learn over a period of time. But there seems to be this like in psychology world that giftedness is under the neurodivergence umbrella, and it can be a thing of its own and or with other neurospice associated with it. But I don't know if I really have met just giftedness without any other pieces. Like I wouldn't say they're also ADHD, but they definitely would have like
Some,
elements
right,
of
right,
some
right.
parts of it.
Yeah, yeah. No, I mean, that very much resonates with my experience as well. Um, yeah, and maybe again, this may be a different topic altogether, but it makes me think about how we're supporting kids and adults who are gifted, who aren't problematic in the classroom setting, who seem to get everything and go beyond what is requested of them, but they're bored and they don't like school. They're not really well supported in the traditional classroom
Hmm.
setting, and
Exactly.
those kids, ADHD can also be overlooked because they are very smart. It doesn't necessarily take as much effort, so they can zone out, they can space out, and they can still do things and turn everything in and get good grades.
Hmm. I also see sometimes the opposite of where the kid can be problematic with ADHD, but then the giftedness is overlooked. And so they're really seeing this child as a problematic child, but because their whole being is not really taken into account and the giftedness is not really paid attention to, maybe because they are bored, they're trying to control the behavior without really seeing that, hey, maybe if we stimulate them more or give them certain things to do, then maybe the behavior piece wouldn't be as big of a problem.
Exactly.
So giftedness is definitely, I feel like, is misunderstood in so many different school districts and parents and people. And
Mhm.
sometimes it's seen as like, oh, it's just a parent who's like just really trying to have their kid be like stand out as smart, but
Yeah.
it's so much
No,
more
but
than that.
giftedness come with its own problems, right? Like you were
Sure.
saying, right? A gifted kid can be bored much more easily. They may be more emotionally dysregulated because they're not stimulated properly. And I don't know that there's adequate support for them or even recognition of what's really going on.
Hmm. Yeah, no, thank you for speaking to me about this because it's actually a passion of mine in various ways. I think you and I both are passionate about it based on the people we see, but also I think based on our own family histories. Like my family history is like full of very gifted, neurodiverse people, and so sometimes now, as I'm beginning to understand what all of this is about, I look back and have so much more empathy for my family members and for people who are also in the community who have similar issues.
Absolutely.
You've mentioned cognitive, what did you mention? Cognitive something of therapy that you
Cognitive
use.
training. Um,
Cognitive training. Can we talk
another
about that?
tool that
I
is
don't know
not.
much about it.
Yeah, it's another tool that is not part of the standard ADHD treatment, but I found to be effective. So, there are different types of cognitive training. The one that I've been using with my patients is called CogMet, and it's a program that specifically aims to improve one's working memory. So, working memory is actually a core component of executive function, and it involves holding information in your brain in your brain just long enough for it to be of use, so it's not long-term memory. It's like the ability to hold a certain number of digits in your brain so that you can do mental math. And in people with ADHD, often working memory is impaired. Not 100% of people with ADHD have working memory impairment, but often they do have working memory impairment. So this
What is
particular
working memory impairment? What does that
so
mean?
so it means not okay. If you think of working memory as like a little sticky note where you can jot down letters and numbers so that you don't lose it and you can use it just a couple seconds, a minute later.
Mm-hmm.
That's basically what working memory is, except it's in your brain. You're not putting it down
Mm-hmm.
on a sticky note.
Mm-hmm.
Impairment means basically you run out of space on that sticky note very quickly. And so, for example, in the classroom setting, the teacher may say, let's open our books to chapter 3 and let's, read the third paragraph and think about how it connects to the prior chapter or something like that. Someone with working memory deficit may have heard just chapter 3 and lose the rest of it. And it could become very frustrating because they get lost. They forget a big part of what the question was. Or they have a very difficult time, remembering numbers. If a kid is trying to do math in school and they're trying to do mental math, they can't remember, they can't picture it in their head. Um, so so that's working memory impairment, and it's very common in ADHD. So what this cognitive training program does is it basically works to strengthen your working memory. And the way I describe it is it's like going to the gym and developing muscles specific to working memory. And it's a computerized program. What it does is it's gamified. So you go on there and then it gives you a series of numbers and letters, and then it asks you to repeat them back. It asks you to sort them in a specific order. There may also be pictures and shapes, located on various parts of the screen. Then you have to hold increasing amount of information in your head. And so the level of difficulty goes up as you do more and more of these and get them correct. And then if you get them wrong, it goes back to the earlier, simpler ones. And so in the process of doing this, one's working memory can improve significantly. Now, the data on this, again, the studies on this are mixed. There are some studies that say, while it improves working memory in the context of these specific games, the far transfer, how that looks in the classroom setting is not as clear. There are also studies that look at kids that have done this and then they do much better in the classroom setting. I've done this with my own kids, and I've done this clinically with a lot of my patients. And I will say, with the right person, the individual that really they do struggle with working memory, and that they are able to stick to the program. It's a rigorous program because it really stretches your working memory. In the beginning, it's fun, and then inevitably it becomes infuriating as you're trying to hold more and more information. But you will see profound improvement, and clinically, from what I've seen in the right individual, it can make a profound difference in their ability to hold information in their head, in their confidence, just like knowing that I can remember what I read early on in the book to make sense of this, this whole context. So that's what it is. What I do is not just giving people that tool, but I also meet with them regularly for the skills coaching part. So that's, the doing the working memory training is part of it, but every week we meet to talk about specific skills that you can use as you encounter problems, as you stretch your working memory. So that's where we talk about recognizing when you're overwhelmed, when your amygdala has taken over and your prefrontal cortex isn't able to do what it needs to do. So how do you reset? Or how do you generate dopamine naturally? So is there anything that you can do to get your mind into a more focused and alert state as you embark on this exercise? So a lot of real life, real time training that goes along with the cognitive training program.
Interesting. This is really, really interesting. So, I remember my parents always used to say to me that when we were growing up, dot, 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 as we always hear from our parents,
Yeah.
they told me that they had to memorize various poems when they were kids, and they had to memorize. I mean, I had to do it too, actually, when I was in Russia as a kid. Not as much here, actually, but we had to memorize poems. We had to memorize the whole multiplication table, and then use that to be able to do math in our heads and not on paper.
Mhm.
Do you think that how the education system has changed is also possibly impacting the functionality of kids with ADHD and how they grow up to be into adults? Like, when you're talking about the cognitive training, is it similar to training the brain as kids to memorize and then use this information in life?
I think so. I think, again, so this is not, based on research. I haven't done the
Hmm.
clinical research, but I do believe that, similar to you when I was growing up, there was a lot more memorization, which I don't think rote memorization is necessarily the way to improve brain functionality. But because we had to do a lot more mental math, we had to learn to stretch, what we can hold in our mind. I think that that was working memory training in real time. And kids do some of that these days, but not nearly as much as we were expected to do. And on the one hand, it's good that they do a lot more conceptual stuff as opposed to memorization. On the other hand, one does wonder if that leaves certain aspects of your brain function that it's just not as well trained, and it's just not, it didn't get the strengthening that it could have had, with the kind of the educational system that we went through.
Interesting. Yeah.
But I also say with the specific cognitive program, it's not just about memorizing things, but it's tailored to your individual progress. So the way the algorithm kind of keeps up with your pace. So it challenges you in just the right way at the right time, which is a little bit different than let's sit down and memorize the formula or memorize, the multiplication table.
Interesting. So interesting. Yeah. How did you find this program?
I was looking for a working memory training protocol for my own child, and that's how I came across it. In fact,
So cool.
I do it myself. My whole family does it.
I wonder if it also helps with preventing dementia as a person gets older.
I don't want to kind of say things that have not been established. I don't think it's been demonstrated that it prevents dementia.
Hmm.
However, I have patients who are older who want to do this to sharpen their working memory, and they feel like it helps them cognitively. What the studies have shown is that I believe in cancer patients who have undergone chemotherapy, this has been effective in lifting brain fog and help rejuvenating the brain. So there have been studies looking into that population in particular.
So interesting. So for the listeners who are listening to all this and who themselves may have ADHD or have loved ones with ADHD or other type of neurodiverse conditions, is there kind of a general recommendation that you can make for them in terms of diet, what they should or shouldn't do, or nutrition, or something you would recommend for anyone who has ADHD?
Yeah. Um, There's many things I would like to recommend, but if we're starting with the diet, apart from the supplements that we talked about that are kind of low-hanging fruits, and obviously work with, with your doctor if you're going to start supplementing. Um, in terms of what we can do with diet, eat real food. Do not eat ultra or eliminate as much as possible ultra processed food. The standard American diet is full of ultra processed foods that are, really depleted in these vital, nutrients that the brain needs, and they can also actually deprive you of things like magnesium. And so avoid them if you can. An advice that I've been given is if you read the ingredients, ask if your grandmother could understand what's on there, or your great grandmother, and as much as possible, stick to real food. Um, Also, if you can reduce the amount of refined sugar, again, we're not talking about complete avoidance of refined sugar, but cut down, because these, spikes rise and fall in blood sugar can be quite detrimental to, cognitive alertness, and can cause crashes that can really exacerbate ADHD symptoms. Understand gut inflammation. I guess, what does that mean? So if you yourself notice that certain foods always make you feel like crap, make you feel bad, afterwards, pay attention to it and see if you eliminate that type of food for a while, if things feel better. Again, I'm not promoting that you go and eliminate all these things, but pay attention, be your own detective. If you always feel bad after eating a certain type of food, you may be sensitive to it, even if there's no overt allergies. And experiment and see, if you eliminate them for a period of time, if your brain feels more focused, if you feel sharper. We know that gut inflammation plays, a significant role in how well our brain functions. Inflammatory cytokines from your gut will travel to your brain and can definitely interfere with dopamine function. The gut-brain axis is a very, very real thing. So we're all connected in that way. So definitely pay attention to what you're eating, how you feel after you eat something, and be proactive. I would also say pay attention to when you're eating and how much you're eating. Again, I don't think there's one. fits all on you should eat this then at this time and but just pay attention to your own biorhythm. How do you feel if you go without food for a certain period of time? How do you feel if you eat a big carb meal? How do you feel afterwards? In general, I would say try to increase the amount of protein, fiber, and healthy fats in your food. If you're going to have sugar, if you're going to have sweets, that's fine. We don't have to eliminate everything, but pair that with proteins and fats and fiber. That helps to stabilize your blood sugar. And often that has a profound impact on your brain function.
Mm-hmm.
And hydrate. People with ADHD often will forget to hydrate. They can hyperfocus on things, and before they know it, the whole day has gone by and they haven't eaten or hydrated. Dehydration is a very common cause of brain fog.
Thank you. How could our listeners and viewers find you and your work?
Well, they could reach out to me on my website, which is www.buckpsychiatry.org. My email is on there. Feel free to reach out to me via email. If you're interested in becoming a patient, you can fill out an initial contact form on there, and then we'll reach out to you. Yeah.
Can the patients also follow you on Instagram?
They can, Dr. Conboy. They can. I have developing a small presence on Instagram, so they can follow me on what's my handle? Dr. Ying Wang. Hashtag Dr. Ying Wang. As you can see, I know the stuff real well.
It's spelled DrYingWang,
Which
correct?
you said correct. Thank you.
And just to verify, you're only seeing patients in Pennsylvania and New Jersey,
Yes,
correct?
correct. And I can do both telemedicine as well as in person. My clinic is located in Pennsylvania.
Are you ready for a lightning round of questions?
Oh boy, I hope so. Depends on what you ask me.
Oh, they're going to be very difficult.
Oh boy,
Question number one.
okay.
What is your favorite animal?
Bunny, no question. I have a bunny.
Bunny? Why bunny?
I think they're called Holland Lop. They have like these big floppy ears.
But why bunny is your favorite one?
His feelings will be hurt if I said anything else because I have a bunny. So right now it
Okay.
has to be Bunny.
So Bunny, if you're listening, she really loves you.
You.
Question number two. Do you prefer texting or talking by phone?
Oh man, that's a good one. Um, I hate to admit it, these days I prefer texting. Even though I came to America at a young age, when I talk, sometimes I still get tongue-tied. And so there's still this insecurity I have about speaking English. Although my Chinese is horrible too. So
You know what? I
texting
completely empathize. I think this is the plight of children who come at this like
right?
really important developmental age.
Yeah,
I think I came here when I was 9. You were what, 11 or so?
11. Yeah.
So I think that the difference is very small, but that difference is like very crucial where we don't no longer know the previous language as well because we weren't there for our teenage years, but yet we don't know the new language as well because we weren't there for the developmental years.
Exactly. So you know my pain.
I do. I get tongue-tied too very frequently, actually.
You sound very eloquent, but that's the reason I prefer
As do
texting.
you.
Thank you. But for heart to heart long conversations, obviously talking is the way to go. For me,
Absolutely. Especially in person. I still don't like phone, but in person
in
is the
person,
best.
much better. Yeah.
All right. An alien gives you a 10-second window to ask one question about the universe. What do you ask?
Oh my, how did it all begin? Before the Big
Ooh,
Bang.
I love that question. That's a profound question. What do you think happened before the Big Bang?
I have no idea. It's like, why world? That's a question that my now 9-year-old asked when he was like 3. His teacher told me he asked, why the world? And I thought, why the world?
And this is why he's gifted. All right. One person you could meet from the past. Who and why?
Right now, I'm thinking Carl Jung. I've been
Mm.
texting you about Carl Jung a bit. I find him fascinating. The concept of collective unconscious and mysticism, introducing those elements into traditional, psychiatry. I just find it and his idea of embracing evidence-based medicine but going beyond that really resonates with me. I don't know if that I framed it correctly. I don't know if he's alive today and heard me, he'd be like completely misrepresenting me. But my bits of understanding of him makes me very curious. Would love dialogue.
What would you ask him?
Oh, that's a good question. I think I would ask him about his own experience with spirituality.
Hmm,
Um, I read a little bit about it, but I would kind of dig a little bit closer and get more personal about how spirituality, how it came to him, how it informed him, and how he came to incorporate it into, a medical practice.
I love that. Dr. Wong, thank you so much for being on this podcast. You are an incredible psychiatrist. I really look up to you
Thank
as
you so
a
much.
clinician, and you're an amazing friend. I'm very lucky to have you as my peer supervisor. The universe has put us together, and I'm just so grateful to the universe for that. And I really appreciate you being on this podcast. It means a lot. And I think that the listeners and viewers will get a lot out of listening to you. Thank you.
Thank you so much for having me. You know, I adore you, I love you, and I really admire and respect you. And I have learned a ton from you. You inspire me all the time. So thank you for doing what you do. And thank you for being such a wonderful friend and colleague and supervisor.
Thank you. Thank you so much. The information in this podcast is for educational and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Listening to this podcast does not create a physician-patient relationship with Dr. Ina Conboy or any guest on this podcast. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast.